So there are several factors that we have to take into consideration when determining if a patient needs to be treated for ATTR-CM. Of course, number one being whether they have ATTR-CM, which would be diagnosed based on imaging-based techniques or based on a endomyocardial biopsy in rare cases these days. Important consideration, of course, is patient's symptoms. And the recommendation for management of these patients, at least clinically and based on consensus statements, is to treat folks who are in their NYHA class 1 to 3 heart failure. Earlier the better. We know from studies that treating patients early on, like NYHA class 1, definitely adds greater benefit and adds longevity than if they are treated when they are in NYHA class 3 heart failure. So again, diagnosis of ATTR-CM, early diagnosis of ATTR-CM is of utmost importance. Folks who are in NYHA class 4 or more on end-stage heart failure, treatment for ATTR-CM is not recommended in those patients because the benefit of treatment in those patients has not been shown, and those patients have not been included in clinical trials of novel therapies for ATTR-CM.
Indication and important safety information. Indication: Attruby acoramidis is indicated for the treatment of the cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions: diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.